Hospital emergency rooms are a vital resource for any Australian community. Unfortunately, Australia's emergency rooms are overcrowded, slow, and often misused by the public. This is not only frustrating for patients and hospital staff, but is also a massive drain of taxpayer resources and money. So how big of a problem is this? Well, according to the Australian Institute of Health and Welfare, last year it cost an average of $900 to the taxpayer for each emergency room visit on average. However, 44% of these visits were deemed to be unnecessary by hospital staff. This leads to the staggering figure of, in Victoria alone, up to $630 million being wasted every year on unnecessary emergency room visits. Overcrowding in emergency rooms is also causing wait times to skyrocket. This leads to patients becoming extremely frustrated and often taking their anger out on hospital staff. MyED is a software solution that aims to give these patients the information they need about hospital waiting times, while also providing a more flexible way of handling large volumes of patients in emergency rooms. MyED is an integrated system consisting of both a mobile app, which will be used by the general public, and a web-based computer program which will be used by the nurses in the emergency department. These systems are both built around an efficient way of sorting patients into a waiting list depending on how severe their condition is. The two main goals of MyED are to reduce the number of patients physically waiting in emergency rooms, while also providing a more flexible experience for those who have already arrived at the hospital and are waiting for their treatment. Our mobile app is focused on giving patients the information they need about the waiting times of their local hospitals. This has the ultimate goal of trying to reduce the number of unnecessary visits to the emergency room. On the app, patients can see detailed information about waiting times of any emergency room in their area, which is updated in real time. Patients can then use this information to make an informed decision about whether or not to visit the emergency room or make other arrangements. If they choose, patients can also enter the hospital's waiting list from home using the app, meaning they don't have to physically wait in the emergency room for hours on end. The app also provides alternatives to visiting the emergency room, such as going to a primary healthcare clinic in their local area or accessing the nurse on call system. The second part of our system is the desktop program. This program will be used by the nurses in the emergency department to admit patients similarly to how things are done today. However, the major advantage of the MyED system is that patients can opt into a callback service. This service allows patients to leave the emergency department after they've been admitted and do their waiting at home or wherever they decide, while still maintaining a position in the emergency waiting queue. This service is of course completely optional, and it's just another way that we are giving power to the patient with our MyED system. MyED is not in direct competition with any existing healthcare service, and in fact would work best when implemented as a supplement to existing healthcare systems. To keep the cost of implementation low, the visual design of the desktop program was kept as similar as possible to existing hospital software. This ensures that the program is intuitive and easy to use for the nurses, keeping the cost of training low. For the most part, the MyED system will run automatically, meaning most of the costs will be front-loaded. These costs include things such as developing the software and implementing it with existing hospital systems. The cost of developing the software is estimated to range between $150,000 and $450,000. Our business plan is to pitch our system to local hospitals such as Bendigo Health, and to then run a trial period to determine whether or not the MyED system is financially viable. If we can prevent just 0.5% of unnecessary emergency department visits in the year, the system will be more than profitable. Improving our emergency departments is a monumental task, and hopefully by giving power to the patient, our system will bring us one step closer to solving this problem.